Ever wondered why hitting your funny bone feels anything but funny? Let's uncover the anatomy behind it. Hello everyone, I'm Dr. Divya D'Sa and welcome back to AceAnatomy, where anatomy becomes simple, visual and unforgettable. In today's video, we are diving deep into the anatomy of ulnar nerve, one of the largest terminal branches of the medial cord of brachial plexus and the principal nerve of the hand. We will explore its origin, course, relations, branches and area of supply. So if you're ready to ace your anatomy, let's get started. Let's look at some of the key features of ulnar nerve. The ulnar nerve is often referred to as nerve of fine movements or musician's nerve because it innervates most of the intrinsic muscles of the hand that are involved in the fine intricate hand movements as required by the musicians while playing musical instruments. It's the largest terminal branch of the medial cord of brachial plexus and its root value is C8 and T1. Ulnar nerve begins in the axilla as a continuation of the medial cord of brachial plexus and terminates in the hand by dividing into superficial and deep branch. So let's study the course of the ulnar nerve from the axilla up to the hand. Let's look at the ulnar nerve course in the axilla. The ulnar nerve arises in the axilla from the medial cord of the brachial plexus having the root value C8 and T1. It receives a contribution from the ventral ramus of C7 and these C7 fibers in the ulnar nerve supply the flexor carpi ulnaris muscle in the forearm. In the axilla, the ulnar nerve lies medial to the third part of axillary artery. Now let's look at the course of the ulnar nerve with the arm. It enters the arm as a part of the main neurovascular bundle and runs distally along the medial side of the brachial artery up to the mid-arm level, that is at the level of insertion of coracobrachialis. There it pierces the medial intramuscular septum of the arm and enters the posterior compartment of the arm and runs downwards to the back of medial epicondyle of humerus. On the back of the medial epicondyle, it is lodged in a groove where it can be easily palpated. The groove is converted into a tunnel called the cubital tunnel by a fibrous band extending between the medial epicondyle and the olecranon process. The ulnar nerve crosses the ulnar collateral ligament in the floor of the tunnel. So the ulnar nerve here behind the medial epicondyle of humerus is termed funny bone because when the medial part of the elbow hits a hard surface, tingling sensation occurs along the ulnar side of the forearm and hand. Now let's study the course of the ulnar nerve in the forearm. The ulnar nerve enters the forearm by passing between the two heads of flexor carpi ulnaris muscle. In the upper third of the forearm, it runs almost vertically downwards under the flexor carpi ulnaris. In the lower two-thirds of the forearm, it becomes superficial and lies lateral to the flexor carpi ulnaris. And in this part of its course, the ulnar nerve and the ulnar artery descend together, the artery being on the lateral side of the nerve. The ulnar nerve does not give any branch in the axilla and in the arm, but in the forearm, it gives some branches. So let's look at what are the branches given in the forearm. So in the forearm, it gives, that is in the proximal part of the forearm, it gives two muscular branches. One is to the flexor carpi ulnaris and to the medial half of flexor digitorum profundus. In the mid forearm, it gives a cutaneous branch which is known as the palmar cutaneous branch. And in the distal forearm, about 5 centimeters proximal to the wrist, it gives the dorsal cutaneous branch. The ulnar nerve is the principal nerve of the hand. So let's look at the course of the ulnar nerve in the hand in detail. Palmar cutaneous branch enters the palm superficial to the flexor retinaculum and provides sensory innervation over the medial half of the skin on the palm. The dorsal cutaneous branch passes dorsally and provides sensory innervation to the skin over the medial third of the dorsum of the hand and medial 1.5 fingers. Then the ulnar nerve enters the palm by passing superficial to this flexor retinaculum, lying just lateral to the pisiform bone. Here the ulnar nerve will be covered by a fascial band which is called as the volar carpal ligament. The space under this fascial band is called as the ulnar tunnel. So just distal to the pisiform bone, the ulnar nerve divides into its terminal branches, that is the superficial and the deep branch. The superficial terminal branch supplies the palmaris brevis muscle and provides sensory innervation to the skin on the palmar surface of medial 1.5 fingers. The deep terminal branch, it enters the Guyon's canal, that is also called as the pisohamid tunnel, under the cover of pisohamid ligament and turns laterally within the concavity of deep palmar arterial arch, and it ends within the substance of the adductor pollicis which it supplies. So this deep branch of ulnar nerve is purely motor and supplies all the intrinsic muscles of the hand, which includes the hypothenar muscles, the third and fourth lumbricals, all the palmar interossei, all the dorsal interossei, as well as the adductor pollicis. Here you need to remember that the ulnar nerve supplies all the intrinsic muscles except the muscles of thenar eminence, that is the thenar muscles and the first two lumbricals. The sensory supply of the ulnar nerve is by the palmar cutaneous branch, which provides sensory innervation to the skin over the hypothenar eminence. The dorsal cutaneous branch of the ulnar nerve supplies the skin over the medial third of the dorsum of the hand and the medial 1.5 fingers. And the superficial terminal branch gives sensory innervation to the skin over the palmar surface of medial 1.5 fingers. And to summarize the ulnar nerve has the root value of C8 and T1. It arises in the axilla as branch of the medial cord of brachial plexus. In the axilla, it lies medial to the third part of axillary artery, and in the arm it forms a part of the neurovascular bundle. It pierces the medial intramuscular septa and enters the posterior compartment of the arm. It lies behind the medial epicondyle at the elbow, and it enters the forearm by passing between the two heads of flexor carpi ulnaris. So in the proximal part of the forearm, it will give two branches, that is one to flexor carpi ulnaris, and also it supplies the medial half of flexor digitorum profundus. In the mid forearm, it gives the palmar cutaneous branch, which supplies the skin over the hypothenar muscles. And in the distal part of the forearm, it gives the dorsal cutaneous branch, which supplies the medial third of the skin over the dorsum of the hand as well as the skin over the medial 1.5 fingers on its dorsal surface. The ulnar nerve then runs superficial to the flexor retinaculum and distal to the pisiform bone. It divides into its terminal branches, that is superficial and the deep branch. The superficial branch supplies the palmaris brevis muscle and the skin over the palmar surface of the medial 1.5 fingers. The deep branch passes through the Guyon's canal and supplies all the intrinsic muscles of the hand except for the thenar muscles and the lateral two lumbricals, that is the first and second lumbricals. And this deep branch, it ends in the substance of the adductor pollicis. In the next video, we will be discussing about the clinical correlation of ulnar nerve. And that's a wrap for today's episode of Decode Anatomy. Thank you for joining me on AceAnatomy. If this video added value to your learning, please like, share, subscribe and hit the bell icon so you never miss an update. Until next time, keep learning with purpose and let's educate, empower and excel.